Hi, I'm Selena, an educator with 20 years of classroom experience and a test prep expert with Study.com. In this video, we will cover the FTCE Health K-12 019 exam, focusing on the knowledge of violence prevention and intervention. You will learn how to recognize warning signs, teach conflict resolution, and promote safe learning environments. Let's dive in. Which of the following strategies best describes a method of direct education about gun violence? A. Providing gun safety locks to parents who own guns. B. Parents should be the only resource to educate children about violence. C. Creating a program for teens to participate in activities after school. Or D. Having the local sheriff speak at a school assembly about teen gun violence in the community. A. Providing gun safety locks is a great safety measure, but it is not education. B. Saying only parents should teach about violence is incorrect. This limits kids' access to important information. C. After-school programs is incorrect. They are helpful for keeping teens busy and out of trouble, but they don't directly teach about gun violence. The correct answer is D. Having the local sheriff speak at a school assembly about teen gun violence in the community. The goal of direct education is to have someone like a law enforcement officer or a former gang member speak to students in direct capacity about the perils of gun violence in the community and methods to resolve conflicts without using guns. Who is the first person documented to have done school violence? A. Paul Orgren. B. Seung-Hoo Cho. C. Adam Lanza. Or D. Andrew Cahill. The correct answer is D. Andrew Cahill. In 1927, Andrew Cahill bombed a school in Bath, Michigan. This is the earliest documented school violence. Which of the following statements best describes the effect of bullying on a student's academic performance? A. Bullying can lead to a decline in a student's academic performance. B. Bullying has no impact on a student's academic performance. C. Bullying boosts a student's self-esteem, thereby improving their academic performance. Or D. Bullying can lead to improved academic performance as it motivates the student to work harder. B. Bullying has no impact. That's false. Research shows bullying can seriously affect mental health, attendance, and grades. C. Bullying boosts self-esteem. That's the opposite of what actually happens. D. Bullying motivates students to work harder is incorrect. Most students don't feel inspired by bullying. They often shut down or avoid school instead. The correct answer is A. Bullying can lead to a decline in a student's academic performance, as it can cause significant stress and anxiety, therefore affecting their ability to focus on their studies. Bullied students may also start avoiding school to escape bullying, leading to poor attendance and poor academic performance. Which of the following is an example of sexual abuse? A. Forcing a person to perform a sexual act. B. Showing sexually explicit pictures to an unwilling person. C. Touching a person's backside without consent. Or D. Sharing sexually suggestive comments or jokes. B. Showing explicit pictures is incorrect. That's sexual harassment, not abuse. C. Touching someone's backside without consent is incorrect. This is unwanted sexual contact and can be harassment or assault, but not always classified as abuse. D. Sexual jokes or comments is incorrect. That's verbal sexual harassment, not abuse. The correct answer is A. Forcing a person to perform a sexual act. Sexual abuse happens when a person is forced to have unwanted sexual contact with another person. The perpetrator usually makes use of force or threats. The other choices are examples of sexual harassment. Thank you for working through some practice questions on the FTCE Health K-12 019 exam, focusing on the knowledge of violence prevention and intervention. I hope you feel more confident on test day. For more practice, check out our FTCE Health K-12 019 playlist. And for even more detailed practice, strategies, and customizable study materials, head over to study.com and check out our FTCE Health K-12 test prep course. Those who use study.com boast a 92% pass rate. Our courses include full-length exams, hundreds of authentic practice questions, and short, targeted video lessons, specifically developed based on the latest test updates. With our resources, you'll know exactly what to expect on test day. Like this video and subscribe to the channel to get all the latest FTCE test updates. And please leave your questions and success stories in the comments. We would love to hear from you. Thanks for watching and happy studying.